Digital health tools have earned their permanent residency in healthcare. Most hospitals today offer patient-facing platforms, and roughly two-thirds of US patients have accessed a health portal at least once. Yet more than 95% use it passively, never initiating contact. Is bad user experience to blame? Which engagement tactics are unethically acceptable in healthcare? This is Two Digital Podcast. I'm your host, Lydia, and today we're unpacking what it means to design for people who didn't choose the product but are required to use it. My guest is Jenn Whittingham, a senior UX and customer experience leader with over 20 years of experience designing digital products across healthcare and other fields. Welcome. UX, user experience, is everywhere. Any paperclip producent has something to do with user experience nowadays. We are talking about healthcare, and this feels like very sensitive, very important area. What those user experience means even in this area, is it somehow fundamentally different from other areas, from retail?
I think it's very different. Every field has a different perspective, a different user trying to do a different task. And so, banking apps, you have to build trust in order to have a good experience. In healthcare, it's even more so. You not only have to build trust, but you are dealing with a very completely different emotional baseline. In banking apps, it's just annoying. In healthcare, people are scared. They're vulnerable. They need calm, or it could be the love of someone that is sick that they're taking care of. So the experience sits directly on top of fear and uncertainty. And our job as UX is to calm that, to kind of take that away and make it a much more pleasant experience. That means UX can normally be more powerful, right? In the healthcare domain, if you can make someone feel safe and cared for while reducing the friction and error as much as humanly possible, you're not just talking about making it pleasant, you're helping them navigate one of the hardest moments in their life.
When a bad user experience in some other types of application means that someone gets annoyed, frustrated, and churns. In healthcare, again, I feel that there is a notion that it must be something probably different. What's behind bad user experience in healthcare applications facing patients?
Yeah, it can be anything from inconvenience to life-threatening if you have a bad experience. A lot of the instances I looked at were people in, cancer patients or oncology patients. And if your app didn't deliver their medication on time, that was a huge impact to the patient. It could send them into a withdrawal. It could harm their health. You have to think about all of the regulations, the insurance that they have to go through. A lot of times, your app couldn't do what it needed to do if the insurance wasn't approved, et cetera. So you're really dealing with people's mental, physical, everything, if your app goes wrong. So you really need to make sure that it's working correctly. You can't, what I say, fail fast when they talk in technology terms and learn. You can't do that in healthcare. So.
Yeah, you've told about regulations. And while doing my due diligence to this meeting, I found that you've talked about triangle, three things: user need, business goal, technical feasibility. And excuse me for building that scaffolding around your structures and adding stuff, but regulations. Some medical healthcare applications, it's not just wellness products. It's like fully fledged medical devices. What does it add or probably take from the user experience, from the design?
It makes it more difficult to design, to also get your research. So you're dealing with HIPAA. where everything is very private. And so you have to have, forms that people are agreeing to allow us to speak to them, to understand where they're coming from, et cetera. In order to understand that the information isn't available in all areas, it's not as easy to get people to participate and understand that. There's a lot of hoops you have to hop through in order to really discover how to solve their problem. And then, of course, designing, you're looking at accessibility issues. You're looking at multiple areas, which makes it a lot harder to design. However, that doesn't matter. What we really have to make sure we're designing for everybody and that we are meeting them and making their lives easier. So it's not about making our lives easier. It's about making our patients' life easier and solving for them. So I think those things are put in place to make sure that we do that, to make sure organizations are willing to put their dollars there, or are forced to put their dollars there. Because in the past, they weren't willing to do that. They didn't see the ROI of that. And a lot of them skipped it. But now it's regulated. And so it's being put out there for the better of everybody, I think.
It's not always organizations which are forced to use something. Sometimes it's patients, unfortunately. They haven't chosen our application. They would rather not be there at all, but they have specific disease and they are told by their physician, for example, to let's go use that application. So how do you design for someone who would rather not be there?
Yeah. So we've got to make it as simple as possible, right? We have to prove the value to that patient. And how we do that is really by understanding, how is this going to make their life easier? How is this going to provide value to them? That it makes it worth opening the app, worth understanding how to go through. We have to make onboarding extremely easy. Buttons easy, single steps, so that they're not overwhelmed when going into an app. They're already in an emotional state. They're already overwhelmed with their health. The last thing they want to be doing is being overwhelmed by the app. So the app actually has to be a positive experience for them. A lot of times too, when we think about this, it's not necessarily the patient that's using the app, but the loved one or the healthcare provider that's using it. And so how do we design for them as well, not just the patient?
I would deviate from our initial plan. As you've said, that there are some third party who use that application. I think it might be even a problem because when we design some product, sometimes it's not the patient who comes to us or with whom we communicate. Sometimes it's relatives who just very much want to solve the problem, but that's relatives, not the very person who has that problem. And I think that there is a risk that we will design the product by the relatives' wishes, forgetting about the patient themselves. Sometimes patients are too old, too frail, and that may result in some not optimal solutions.
That is, yes, definitely a concern, right? I think that's where we have to design. We're still always designing with the patient in mind, the doctor in mind. In mind, right? And so our job is not just, sometimes there's confusion, right? UX, they think of screens and layouts and things like that. And our job really isn't that. That's kind of what I used to explain. If you're eating a cake or a cupcake, that's the sprinkles on the top that make it look pretty. What we're doing is we're really figuring out what are the ingredients that make that delicious cupcake. But if you have a dietary restriction, no matter how delicious we make it, you can't eat it, right? And so the cupcake, doesn't matter if it's the best cupcake in the world, you'll never know if it tastes good because you're not our client. And so what our job is to really understand who these people are, what they're struggling with. So for the and what is the main goal of this application? How is this making somebody's life better? And so we do a lot of research with those people that we're serving. And I always say it's UX is very much, when I first got into healthcare, very much it's a patient doctor relationship. UX is the same thing. We're going in there, we understand there's a problem. They've called us. So we, instead of the patient coming to our office, a lot of times we go to, their home or whatever, their office. And then we sit down and we listen to what the problems are, right? Just like the patient comes in and says, I'm not feeling well, I have a headache. Our product is creating a headache. I don't know. But then we sit and we ask questions to really diagnose and understand what is this problem. And then we eliminate things as we're speaking that, okay, that's not it because this isn't happening. That's not it because this is happening. And we narrow it down to where we say, okay, we think this could be the problem. It's our hypothesis. Just like a doctor says, okay, I think this could be your condition. Let's try these medications. If those medications don't work within a week, come back to us. We'll try a new medication. We're doing the same thing. We're saying, okay, we think this is what the problem is. We're going to put together a quick solution, which is our wireframing. And we're going to present it back to you. And you're going to tell us, does this help you solve your problem or no? And we're going to iterate on that until we figure out that we have solved their problem. And then that's when they take it into production or whatever. So I really look at UX as it's not pixels and screens. It's basically a doctor-patient or a UX practitioner / user relationship. And so we're really understanding who is our main target audience. What do we need to solve for them? Okay, they're going to have these caretakers or these family members that may have to help them in the app.
With all those problems people are facing, it's usually true that people, they don't want another app. They don't want another device, neither patients nor healthcare professionals. They want their problems to disappear. And when you go and introduce some new device and says that you will have to spend like 5 more seconds pressing this button, they will probably say that, no, then I don't need that. I will do that as I did it for the last 30 years. So that's a behavioral issue. Let's narrow it down, that people tend not to download another application. They want to use WhatsApp, AI helper, which they already got familiarized with. So does this dictate how you do, how you design your products?
Yes, I think in the future we will see that. We will see where maybe they have an agent that can speak to other agents. We're bringing a lot of AI into our products. We still have apps. We still have native apps is what we call them, which are ones you have to download. Then there's always the web apps, which you type in a URL and you get to an app. The AI agents, or, you go into ChatGPT, you're still typing in chatgpt.com. You're still doing that. So I'm curious if at some point they will have more web app versus native app. I would have to really look at the security behind implementing a web app that can then tie across all these AI agents and become more of, that system working across all agents to get information. I think it's a little scary right now because of the information you can get and what you're advising patients to do, et cetera. I think you have to be very, very careful there too. And maybe in a native app, you can control that more. Versus these others. So, and I wonder about security issues as well. Yeah. So We're all just figuring that out right now. There's a lot of talk behind AI. I've been in this industry 30 years and I've seen these evolutions about every decade, and we think it's the greatest thing and it's going to solve everything. But after a while, you kind of backtrack a little bit and you realize really what AI is really good at and what it's not good at. And I wonder if the same thing is going to happen here, where we're like, yeah, AI is really good at this and it's really terrible at this. And so we're going to back it up. We're going to use it for what it's really good at. It should never, ever be used for everything, right? It should be used only to make something better for somebody. I think we're all still just discovering what that is. And right now, and to use it in healthcare, I think about it as, the right time to use AI in healthcare is like going into a pharmacy and there's over-the-counter drugs, and then there's drugs that you have to get a doctor's, okay on to be able to use. AI, in my opinion, is the over-the-counter prescription. It's let's give you enough information that you can get it quickly. You can calm your nerves. It can do the repetitive things. There's not a whole lot of harm it can do to you by looking at the information. So let's use it for its benefits that it can give you immediately. But anything that is risky or could harm your health, you want that AI agent to know when to say, hey, you need to go speak to your physician, make an appointment with your physician, or we're going to pass you on to, a professional to really answer the rest of these questions.
By the way, FDA introduced a system, AI, which helps people to get their prescriptional drugs. So I'm not sure whether it's such a great idea, but who am I to judge?
I think like for that, I think it's okay if it's just like an auto, renewal of your prescriptions and getting them sent out, and doing the legwork that is busy work. I think that's okay, to make sure they're getting them on time and leaving the doctors or the pharmacists that extra time not answering everybody's same question. That's simple to answer, but giving them more time to answer some of those more urgent, harder questions, so that gets the patient that's really in need that answer more quickly. I think that's where AI comes in really well.
That's completely layman's question, and maybe I'm missing something big time in here, but everything here to me sounds like something which can be solved with usual programming, like if yes, but what's the place for AI in this? I know that we get derailed, but probably we can find something in this part of the conversation, or probably we won't. So,
yeah. Well, I think AI learns from itself, right? Whereas programs, we may, until the human goes in there and says, okay, yes, this person's prescription is due on this date, and we're going to send it out every month on this date to them. And AI could say, this patient they need it every Thursday, but they've actually pushed this one off. This is just a very generic example, but it's learning from our behavior. So if we say, okay, they need it on this date, and we're going to send it on this date, and then they send it again, and then the user says, okay, I've gotten 2 prescriptions. I have way too much. I'm going to hold off on this next one. It can then say maybe the person doesn't need as much, and we'll put it out we'll ask them if they want it pushed out every month and a half instead of every month. And we'll also notify the physician that this patient isn't needing this as much, or vice versa. They're running out way too fast. It can notify the physician. It can do all these things, and it learns. So AI agents are learning from our behavior and then modifying and then sending that information back to the patient, back to the doctor, and allowing them to maybe be more informed of the patterns that are happening versus just a regular program. You're not really learning from it as much.
Let's dive into a bit of a different field in here. VR, like probably the most extremely invasive type of interface we have, like where everything around you is simulated. Is there any rule, or are there any rules? How should you look like in those devices, in those cases when we use that?
I think in UX, a lot of times, who's saying it's invasive? When is it invasive, right? I think you have to look at that. It can be invasive, but if you think about a child, at the doctor's office where they're sitting on the thing and they have to get a shot and they're terrified, if you put on that device and it's surrounding them with stuff while you're giving them the shot, what's more invasive, the fear of the shot or the fear of the device? So it's really actually solving a problem. I think, in other situations where a patient might have, what's that called, where they get dizzy and balance issues, et cetera, that might be the totally wrong solution for them.
Yeah, only to make things worse.
Yeah. So I really think it comes down to that exact person. That's what user experience is all about, is who is our user? What is the best experience for them, and how do we design that? I've heard this phrase, and it's so true. The obvious isn't always the obvious, right?
While you were answering that question, I remember that I had situation in my own experience with that VR system, exactly helping children overcome that fear of shots.
Yeah.
And the guy who was working on this system said that one of the problems they encountered was that the default visualization was not very enticing for children. That was whales or something like, and that didn't help much. And they made a decision to change that for cartoons. And they've chosen cartoons which are relevant for children who live in that area where their clinic is located, and that made a huge difference.
Yeah.
So,
yeah, I think, so many hospitals are doing this right now, which is so cool. They will make an entire experience for the children so that it's not scary, like an MRI machine. Having to go into a tube and sit there for a long period of time is terrifying for a little child in a sterile environment. They see this big white machine, and a company, and I did research on this a while back, but they turned the entire thing into an experience like going to Disneyland. And so when the child walks in the front door, they greet them as Captain Emma, and they give her a pirate hat, and they walk her down, not the plank, but the dock. And then when they open the room, it's decorated, the entire room's decorated as a pirate scene. And the MRI machine is the pirate ship. And so when they put on their gown, they're in their pirate outfit, and they then have the nurse speaking through in the little mirror. They have the show going on that they have to look at. And that is in the same rhythm as the beeps and the buzzes of the machine. And then it's over and they pull the child out, and they are, it's a great experience for them. It's like going on a ride versus walking into this sterile, cold room with this big, scary machine. And at the end, they get, their gold coins and they thank them for coming. So they have really done a lot to make the hospital experience less scary for children, for adults. They're designing rooms now that are more like the outdoors, things like that, just to provide that emotional and physical environment that changes their mood, and their mood can change how they're feeling and actually make them better or less scared or whatever. And that's really what UX is how do we take that barrier of fear and anxiety away? Because I don't think the problem is really the treatment. It's the fear of the unknown. It's the fear of the experience. And that's our job, is to kind of, make it as best experience as they can, so that it's not so scary.
I would want to have a pirate hat, actually, myself. Why not?
Right.
Are there any other trends in this field which seem to be like staying with us for the next couple of years, maybe decade? Do you see something? If not, then
I think, in my lifetime of doing this, which has been a long time, I've seen a lot of change. I've seen a lot of, I look at AI as it's another tool to use for the better of the experience. We shouldn't just be using it to use it. There's a place for it, and there's a place where it shouldn't be used. Moving forward, right now I'm so concentrated on the AI and the experience. I'm not really sure what's coming next. I think right now we're dealing with what we have today, and the experimentation, I call it, of what's possible with AI and solving for that. There's so many avenues to take. I think get overwhelmed with them. And my main job is really paying attention to, how do I make someone's life better? How do I improve it? Not necessarily the tools. And when you look at that comes back down to the foundation of it. It comes back to always having a person in the loop there. I think people are always going to want a person to talk to. I know the new generations, maybe not so much, I've learned they're much more tech savvy. If they can avoid human interaction as much as possible, they prefer it. But I still think at the end of the day, if you can't figure it out yourself through an app, through something, you're going to pick up a phone or send a text to get someone to solve the problem. So I think there's going to be lots of things that come in and out that will help us. But I think staying grounded in knowing the real problem to solve, not getting swept away by the new tools, the new things, is really the most important. And when they come in, we learn from them. We see how they can make us better at what we do, or help that person's experience better than what it is today, which is what we're trying to find out right now.
Again, I was searching the internet before this call, and I found your expression that your purpose is allowing others to experience their greatness. Again, with healthcare, people sometimes using our products at the lowest point of their lives. So how does that influence how you are thinking about design?
Design can't erase illness, right? But it can give people back a sense of agency. And that's often where their greatness shows up. And so how we go about doing that, and what I think about is we're looking at their lowest point, and or they're in their lowest point. And in experience, we solve for that by really understanding what are those low points that they're at. If they're already at their lowest point, how do we bring them up to just baseline, right? And because that'll make their experience better, even if it's at just the baseline. And then if we can get it from baseline to delightful, then how do we do that? And I always think about that when we're designing. It's all about a journey of a person, and what does that look like, and what are their low points, what are their high points, And we will look and say, okay, what is their lowest point, or the one that's causing them the most pain, the most anxiety? And let's concentrate on that first, because if we can solve for that, that's one piece that's bringing them back up to baseline, to make them feel normal, to make them feel calmer, to make them more secure. We'll solve for that. And then once we've solved for that, we'll go to the next bottom one and we'll solve for that until we've got them completely at a baseline of feeling very safe, feeling like they can trust that this is going to help take care of them in some way, shape, or form as quickly and easily as possible. I think a digital piece is just a part of caring for them and their healthcare journey. It needs to make it better. It does not need to be a barrier. We want to make sure it's not a barrier. If anything, it should be doing. If it is a barrier, we should just remove it. It has to be doing something to improve their experience in their healthcare journey.
Okay, I ran out of questions. Thank you for joining me. That was really delightful.
Yeah, you're welcome.